Things you need to know about your breast augmentation. Now, the most common way to perform this surgery is with a scar on the breast. And the most common incision that all plastic surgeons are taught to use is an incision underneath the breast, what we call an inframammary incision. That cut can be placed right in the fold, the inframammary fold. It can be placed slightly above. It should be never placed below the fold, but I don't like that incision because it isn't completely hidden and it's an area that is more or less fairly smooth skin. I don't like incisions that are right in the fold. The reason why is that if you wear a bikini and bikini rides up a little bit or bra, then that incision will be visible. Most surgeons will place the incision slightly above the fold to hide the appearance so that somebody could wear a bikini or bra and not be afraid of showing their incision. When you do that, the incision is right in the middle of very smooth skin, no shadows or fold to hide that scar. And I feel that is one of the more visible scars for this procedure. Most surgeons will say that it's the safest way for them in their hands because they don't have the skill or experience or training to do it otherwise. So that is probably the standard way that plastic surgeon will do this procedure. In the vast majority of patients, that's what they're going to get, a scar underneath the breast somewhere. The other choice that a lot of surgeons will use and a lot of patients will get is the scar or the incision around the areola. The areola has that transition between dark skin and light skin right at the edge of the areola, and an incision can be made there and an implant placed through that area. That has the advantage of being hidden because most women will not show that area of their body when they're in public, and it doesn't have the problem of being shown underneath the breast. However, there are a bunch of problems with that incision, and that's why I almost never use it unless we're doing revision and the scar is already there. The reason why I don't like that incision is that the scar can be visible and can be visible in different ways. Sometimes it's a faint white line, sometimes you can barely see it, which is great, but I have seen a lot of cases, revisions from other surgeons where the scar is indented. Scar tissue can draw the scar inside and that can cause a fairly visible deformity. It's a strong indentation. Sometimes the scar can be visible and then you have a scar that's right in the middle of the breast, so every time the patient is not wearing clothes, the scar is visible. The other problems are loss of sensation. The nerves come from the breast along the side and they course into the nipple and areola from the bottom. And cutting through that area can cause numbness of the nipple and areola, which obviously most women don't want. The other problem is that there are a lot of bacteria underneath the areola. There are a lot of ducts and tubes that are designed to drain the breast milk into the nipple and areola, and all those tubes always contain a little bit of fluid. That fluid is very easily colonized, or that fluid has bacteria in it. That bacteria can get on the implant if the implant is placed through that incision, and I feel the risk of infection and hardening of the implants is much higher when the implant is placed through an areolar incision. And that's why I don't like that incision. Hope you like this video. Stay tuned for part number 2, which is more things you need to know about your breast augmentation.